Maintaining cardiovascular health and physical function becomes increasingly important after age 60. Regular appropriate exercise supports heart health, helps manage blood pressure, improves balance, and maintains independence. Today we're covering 4 exercises specifically beneficial for older adults: walking, chair squats, wall push-ups, and leg raises. Each targets different aspects of cardiovascular and functional fitness while remaining accessible and safe when practiced with proper form. These exercises can be performed at home with minimal equipment and are appropriate for most older adults when combined with appropriate medical care. Before we begin, this is educational content, not medical advice. Always consult your healthcare provider before starting new exercises, especially if you have cardiovascular disease, high blood pressure, joint problems, or other health conditions. These exercises support health but do not replace medical treatment or prescribed medications. Understanding exercise and cardiovascular health after 60. Regular physical activity provides multiple cardiovascular benefits for older adults. Aerobic exercise like walking helps lower blood pressure, typically by 5 to 10 millimeters of mercury with consistent practice. Strength exercises support circulation and reduce cardiac workload. Balance and functional exercises reduce fall risk and maintain independence. Consistent moderate exercise improves overall cardiovascular function. However, exercise works best as part of comprehensive cardiovascular care that includes appropriate medications, dietary modifications, stress management, and regular medical monitoring. Exercise complements but does not replace medical treatment. Exercise 1, Brisk Walking for cardiovascular fitness. The first exercise is brisk walking, which provides aerobic cardiovascular benefits. Walking at a moderate pace where you can still talk but feel your heart rate increase provides optimal cardiovascular stimulus for most older adults. Regular brisk walking supports cardiovascular health by improving heart efficiency, helping lower blood pressure over time, supporting healthy circulation, improving aerobic capacity, and assisting with weight management. Research shows that 30 minutes of moderate intensity walking most days can help lower systolic blood pressure by approximately 5 to 10 millimeters of mercury in people with hypertension over several weeks to months. This is a modest but clinically meaningful reduction when combined with other treatments. Here's how to practice brisk walking safely. Start with your current comfortable walking pace and duration. Walk at a pace that elevates your heart rate slightly but allows you to still hold a conversation. This is moderate intensity. If you cannot speak comfortably, slow down. If talking is completely easy with no increased breathing, walk slightly faster. Begin with 10 to 15 minutes if that's comfortable, or even 5 minutes if you're starting from a sedentary baseline. Gradually increase duration by a few minutes each week as tolerated. Aim to build toward 30 minutes most days of the week over several weeks or months. Walk on safe, even surfaces to reduce fall risk. Use supportive footwear with good cushioning and traction. Important guidelines: warm up with slower walking for a few minutes before increasing pace. Cool down with slower walking at the end. Stop and rest if you experience chest pain, severe shortness of breath, dizziness, or unusual symptoms. These require immediate medical evaluation. Some increase in breathing and heart rate is normal and expected. Severe symptoms are not. Walk with a companion if balance is a concern or you have significant health conditions. Consider using a walking aid like a cane or walker if recommended by your healthcare provider. What to realistically expect: with regular practice 5 to 7 days per week over 8 to 12 weeks, you may notice gradual improvement in walking endurance and distance. Possible modest reduction in blood pressure, typically 5 to 10 millimeters of mercury when combined with other treatments. Improved cardiovascular fitness and stamina. Better mood and sleep quality. Walking benefits are gradual and work best combined with appropriate medications and medical care. Walking alone cannot prevent heart attacks or replace cardiovascular medications. Exercise 2, chair squats for lower body strength and circulation. The second exercise is chair squats, which build lower body strength, important for circulation and functional independence. Strong leg muscles, particularly quadriceps and glutes, support efficient circulation by helping pump blood back toward the heart. This reduces cardiac workload. Chair squats also maintain the functional ability to stand from seated, which is essential for independence. Here's how to perform chair squats safely. Sit near the front edge of a sturdy chair with feet flat on floor, hip width apart. Cross your arms over your chest or extend them forward for balance. Lean slightly forward from your hips and press through your feet to stand up. Pause briefly at the top in a stable standing position. Slowly lower yourself back to seated with control, don't drop heavily into the chair. That's 1 repetition. Perform 5 to 10 repetitions. Rest briefly. Complete 1 to 2 sets. Practice 3 to 4 times per week. Key technique points: keep your weight in your heels and midfoot, not toes. Allow your knees to move forward naturally as you stand, but don't force them past your toes. Keep your chest relatively upright as you stand, avoid excessive forward lean. Use your arms for assistance if needed by pushing on your thighs or chair arms. Progress gradually toward arms-free standing as strength improves. Modifications: if standing without arm support is too difficult, use your arms initially and work toward reducing assistance over weeks. Adjust chair height: higher chairs are easier, lower chairs are more challenging. Only lower as far as comfortable, partial range is acceptable initially. For more challenge once basic version is mastered, hold the standing position for a few seconds before lowering. What to realistically expect: with regular practice 3 to 4 times per week over 8 to 12 weeks, you may notice improved leg strength for standing and walking. Better circulation in lower legs. Increased confidence in standing from seated. Improved functional independence. Lower body strength builds gradually over months. This exercise supports but does not replace cardiovascular medications or treatment. Exercise 3. Wall push UPS for upper body strength. The third exercise is wall push-ups, which build upper body strength while being joint-friendly. Upper body exercises support overall circulation, help maintain posture, and preserve functional upper body strength needed for daily activities. Wall push-ups are safer than floor push-ups for most older adults because they reduce stress on joints while still providing strengthening benefits. Here's how to perform wall push-ups. Stand about arm's length from a wall on a non-slip surface. Place both hands flat on the wall at shoulder height and shoulder width apart. Keep your feet planted and body relatively straight. Slowly bend your elbows, allowing your body to lean toward the wall. Lower yourself as far as comfortable, typically until your nose is 6 to 12 inches from the wall. Push through your hands to straighten your elbows and return to starting position. That's 1 repetition. Perform 8 to 12 repetitions. Rest briefly. Complete 1 to 2 sets. Practice 3 to 4 times per week. Important form points: keep your body relatively straight from head to heels, don't let your hips sag. Move at a controlled pace, taking 2 to 3 seconds to lower and 2 to 3 seconds to push back. Breathe naturally, exhale as you push away from wall. Keep your core gently engaged throughout. Modifications: stand closer to the wall for an easier version with less body weight resistance. Stand farther from the wall for more challenge once basic version is mastered. If wrists are uncomfortable, try placing hands slightly wider or at different angles. What to realistically expect: with consistent practice 3 to 4 times per week over 8 to 12 weeks, you may notice improved upper body strength for daily pushing tasks. Better posture and shoulder stability. Maintained functional ability for activities requiring upper body strength. Upper body strength improvements are gradual. This exercise supports overall fitness but does not directly lower blood pressure or replace cardiovascular treatment. Exercise 4. Leg raises for lower body strength and circulation. The fourth exercise is leg raises, which strengthen leg muscles and support circulation. This exercise can be performed seated or lying down, making it accessible even for those with limited mobility or balance concerns. Strong leg muscles support circulation, particularly venous return, the flow of blood back to the heart. Here's how to perform seated leg raises. Sit upright in a sturdy chair with feet flat on floor. Slowly straighten one leg, lifting your foot off the floor until leg is extended or as straight as comfortable. Hold the extended position for 3 to 5 seconds. Slowly lower your foot back to floor with control. Repeat with the other leg. Perform 8 to 12 repetitions per leg. Complete 1 to 2 sets. Practice 3 to 4 times per week. For lying leg raises, lie flat on your back on a mat or carpeted floor. Keep one leg bent with foot flat, or extend both legs, whichever is more comfortable for your lower back. Slowly lift one leg about 6 to 12 inches off the floor, keeping it relatively straight. Hold for 2 to 3 seconds. Lower slowly with control. Alternate legs. Perform 8 to 12 repetitions per leg. Key points: move slowly and with control throughout. Keep your core gently engaged to protect your back. Don't hold your breath, breathe naturally. Only lift as high as comfortable, full range isn't required. Modifications: seated version is easier than lying version. Support your back against chair back for seated version. For lying version, keep one knee bent if extending both legs bothers your lower back. What to realistically expect: with regular practice 3 to 4 times per week over 8 to 12 weeks, you may notice improved leg strength and endurance. Better circulation in lower legs. Reduced lower leg fatigue. Improved confidence in leg function. Leg strength builds gradually over months. Creating a cardiovascular exercise routine. Here's how to incorporate these 4 exercises into a comprehensive routine. Walking should be your primary aerobic activity most days. Aim for 30 minutes of brisk walking 5 to 7 days per week, building gradually to this goal over several weeks or months if starting from a sedentary baseline. Add strength exercises 3 to 4 times per week, chair squats, 1 to 2 sets of 5 to 10 repetitions. Wall push-ups, 1 to 2 sets of 8 to 12 repetitions. Leg raises, 1 to 2 sets of 8 to 12 per leg. Strength exercises take 10 to 15 minutes total. This creates a balanced routine addressing aerobic fitness, lower body strength, upper body strength, and circulation support. Adjust based on your current fitness level, medical conditions, and how your body responds. Important medical context and limitations: these exercises support cardiovascular health but exist within essential medical context. They complement but do not replace cardiovascular medications. Never stop or reduce medications without explicit physician guidance. Blood pressure reduction from exercise is modest, typically 5 to 10 millimeters of mercury. This is clinically meaningful when combined with medications but insufficient alone for many people. These exercises cannot prevent heart attacks, strokes, or other cardiovascular events. They reduce risk but don't eliminate it. They may not be appropriate without modification if you have recent cardiac events or surgery, severe uncontrolled hypertension, significant heart rhythm problems, severe arthritis limiting movement, or balance problems making exercises unsafe. They work best combined with comprehensive cardiovascular care including appropriate medications, heart-healthy diet, stress management, adequate sleep, smoking cessation if applicable, and regular medical monitoring with your healthcare team. You should consult your healthcare provider before beginning if you have existing cardiovascular disease, high blood pressure currently treated with medications, diabetes or other chronic conditions, recent surgery or significant injuries, or any uncertainty about exercise appropriateness for your situation. Monitoring your cardiovascular response when exercising. For cardiovascular health, monitor your response carefully. Positive signs include gradual improvement in exercise tolerance, feeling stronger during daily activities, possible modest blood pressure reduction over weeks to months, improved mood and sleep, and sustained ability to exercise without concerning symptoms. Concerning signs requiring immediate medical attention include chest pain or pressure during or after exercise, severe shortness of breath beyond normal exertion, dizziness or lightheadedness, unusual fatigue or weakness, irregular or rapid heartbeat, or any other symptoms that concern you. Some increase in breathing and heart rate is normal during moderate exercise. Severe symptoms or not. If you experience concerning symptoms, stop exercising and seek medical evaluation. Do not assume symptoms will pass. Realistic timeline for cardiovascular improvements. Cardiovascular fitness improvements occur gradually. Weeks 1 to 4, initial adaptation period, learning proper form and technique, beginning to establish routine, may notice slightly improved exercise tolerance. Weeks 4 to 12, more noticeable improvements in exercise endurance and stamina, possible modest blood pressure reduction beginning to appear, typically 5 to 10 mm of mercury when combined with medications, improved confidence and functional ability. Months 3 to 6, continued gradual improvements in cardiovascular fitness, established sustainable routine, maintained blood pressure benefits with consistent practice, overall improved functional capacity. The goal is gradual sustainable improvement supporting long-term cardiovascular health when combined with comprehensive medical care. Conclusion: these 4 exercises, brisk walking for aerobic fitness, chair squats for lower body strength, wall push-ups for upper body strength, and leg raises for circulation support, provide a comprehensive accessible approach to supporting cardiovascular health after age 60. They address multiple aspects of cardiovascular and functional fitness while remaining safe and practical for home practice. Start gradually based on your current fitness level. Build duration and intensity slowly over weeks and months. Practice consistently most days of the week for walking, 3 to 4 times per week for strength exercises. Monitor your response and adjust as needed. Most importantly, maintain these exercises as part of comprehensive cardiovascular care that includes appropriate medications, medical monitoring, and healthy lifestyle practices. Thank you for watching. For specific concerns about cardiovascular exercise, blood pressure management, or appropriate exercises for your medical situation, consult with your healthcare provider or cardiac rehabilitation specialist for personalized guidance. Subscribe to Wellness Decode for evidence-based information on cardiovascular health and safe effective exercise for older adults, practical guidance that respects medical complexity while providing accessible approaches to supporting heart health and functional independence.